When you do it right, you can avoid the drills, you can avoid the pain, and ultimately avoid, a root canal, which is something that nobody wants to go through. So we don't want that with our teeth or with compliance.
Matt, good afternoon.
David, good to be with you, man.
It's so good to see you. We're here live at the 2025 Dental Leadership Summit. As I like to kind of frame it, this is our coffee shop talk with our preferred partners and vendors that are doing some incredible things in the industry. And we're so glad to have you and the Abyde team here with us.
It's great to be here. Love what y'all are doing. It's been a great couple of days and excited to see how it goes and ends over the next few.
Yeah. And like I said, I have my coffee. Hopefully it's as strong as our compliance requirements. But before we dive into some serious stuff, I'm going to just start with a quick, simple question. If Abyde was a dental procedure, what would it be?
Probably have to say, the full comprehensive exam, right? So we're going to help analyze and see what's going on first and foremost. We're going to look under, what's under the radar, in terms of like an X-ray.
Yeah.
What are the things that maybe aren't seen at the surface?
Yeah.
And then we're going to polish it off and give you that fresh minty feeling at the end. But it's, one of those things where it's not fun, just like it's not fun to go to the dentist. Compliance isn't fun.
Right.
But when you do it right, you can avoid the drills, you can avoid the pain, and ultimately avoid, a root canal, which is something that nobody wants to go through. So we don't want that with our teeth or with compliance.
Right. And I like that you said that, because when I think about us at HR for Health, it's kind of like we're sort of like the root canal in the sense that, you're really glad when it's done right. But nobody wants to think about it on the compliance side, right? So speaking of those things, what's the most ridiculous horror story that you've heard around compliance or dealt with around?
Oh man, I mean, unfortunately we've been through a lot of them, even with our customers.
Yeah.
We've seen and heard horror stories coming from the Office for Civil Rights or state attorney generals.
Wow.
But I think something that may resonate with those that are listening. We had a practice. It was an eye care practice, but they had a sale on lenses and frames.
Okay.
And all they did was send out an email to their patients. Unfortunately, they CC'd everybody rather than BCC. And it caused a breach, right? They had a patient complain. And so they had to go through a rigorous investigation because of it with their state attorney general.
Wow.
And so, we hear all the time, how important is the data that I have? I'm just an eye care, just a dental practice. Is that really sensitive data? And maybe the diagnoses aren't.
Yeah.
But, email addresses and names and dates of birth and social security numbers are.
Right.
And that's what, those on the dark web, those hackers, those with malicious intent are trying to scoop up. And so because there was that breach, they had to spend a lot of time, a lot of energy ensuring that they didn't end up with any penalties. And thankfully, because they were working with us, they didn't.
Yeah.
But, we've seen all too many where it has. And so, just one of those things where you just would never think about something like that, right? CCing rather than BCCing, cause a lot of heartache and a lot of stress for them.
Yikes. Thanks for sharing that. So you founded Abyde in 2016, right?
Yes.
So that's it's almost a decade ago. And that in technology times, that's like a century. So what was the one thing or the collection of things that kind of germinated in you that were like, I have to deal with this and form, this company and have that as a solution?
Yeah, I think, my background was in the MSP world, right?
Yeah.
So I was helping them out with their technology and the company that I was working with. And we just had a lot of our customers come ask us about these HIPAA audits they were going through in 2015. And, I said, well, if you didn't come to us, who else would you go to help you with this? And they pointed, to the different providers at the time and just saw that there was no real easy solution for, an independent practice to implement and sustain a compliance program.
Yeah.
And so, we started consulting with them and working with them and doing a manual process and training the staff and documenting, everything that they need. And it's just not a repeatable, scalable system, right?
Right.
Not only for ourselves, but for our customers. And so in my mind, it was like, TurboTax for HIPAA. Why don't we just give the practice the power in their hands and allow them to navigate it. But if you make the software easy enough, like TurboTax, right, you don't have to be an expert. It really takes care of all that they need. And so, I don't have a background in coding. I don't have a background in entrepreneurship. Never really set out to start my own company. But one of those things deep down inside, I just knew that, if I didn't do this, somebody else would. And I think, we're all capitalists here, and I saw a great business opportunity and obviously found a partner that I trusted and was able to jump in with. And, the rest is history. But, just really one of those thoughts where if I didn't do this, somebody else would. And let's take a go at it.
Right. No, I like that. That's a really unique perspective. So like with us at HR for Health, we're working with over 3,000 practices. How do you guys look at your part of the business and answer those questions that your clients need without them having to feel like, hey, do I need a PhD in regulatory law and understanding? Like, how does that kind of flow?
I love it, right? So, I kind of just use the TurboTax analogy. Same thing there, right? I was 22 years old coming out of Florida State school, right? So you understand where my knowledge was on taxes. I didn't know a lick about taxes, right? But I knew that if I used TurboTax and because of the simplicity behind it, it was asking me really easy to understand questions. I knew I could give it honest answers, right? And then the software dynamically generated everything that I need to be compliant with the IRS. It's exactly what we do at Abyde, right? You don't have to be a compliance expert. Usually the person that's handling compliance, the doctor, the business manager, someone in billing, an administrator, they're wearing 10 different hats on a daily basis. And so they don't have the expertise. They don't have the time either. And so what we've done is we really feel like we've buttoned up the process to where they don't need to have a degree in this, right? They don't need to have, they don't need to be an attorney, to understand. So we've just gone through the latest audit protocol that the government has set out and simplified exactly what they're looking for, giving it to the practice in practical terms so they can answer those questions confidently. And the software does the rest. Really, it'll document and package everything that they need to hand over to the government.
No, that's nice. That's awesome. Okay, so elephant in the room, right? Or should I say OSHA violation in the room? Everyone thinks compliance is about avoiding fines and kind of staying out of, sticky situations and hot water. But how do you position Abyde to be about growth, rather than just don't get sued, don't get caught? Like, what is that?
It's actually a great question because I think that's where most people live, right? I want to check this box to protect myself. And I think that's great, right? Not to get sued. One of the examples that comes to mind, back in the late 80s, there was a company, Alcoa company, I think they might even still be around, but they were providing aluminum products for anything from Coke to Hershey wrappers. And they were struggling a little bit in the late 80s. A guy named Paul O'Neill came in and became their CEO. He addresses the full team at one point when he first comes on. Everybody's thinking he's going to be talking about profits, right? Profitability. He's going to be talking about money. The only thing he talked about in his kind of State of the Union speech was about worker safety. And he made worker safety the number one priority. And why did he do that? Because he understood that when you do that to an organization, it allows for communication, allows for collaboration, streamlined processes and workflows, right? If you want to go from multiple safety incidents in a year to he said, I want 0 safety incidents over a 12-month period. You've got to tighten things up, right? And so what that did is it got everybody energized and enthused around those new processes and collaborations. Profitability skyrocketed with it, right? And so the same thing goes for Abyde, right? We feel like when you implement a compliance program and you're doing it the right way, you're showing to your staff, you're showing to everybody that looks at your patients, everybody that looks at your organization that it's important and you're improving workflows, you're improving processes, and ultimately ensuring that, whether it's, something on the safety side for OSHA or patient privacy side for HIPAA compliance is important. And that gets everybody energized, right? And so that's what we feel like Abyde is. If implemented properly, it shows how important it is to the organization. And that's going to get everybody to buy in. And it really separates that organization from most down the street, right? Where either HIPAA is something that or in OSHA is something that they don't talk about or they just avoid, or they do the lowest amount possible. Or even just one piece of, many different pieces that need to be implemented just to kind of skate by. So it's a great way for an organization to separate themselves and get the employees and get the patients, to buy in what's going on, that, holistically, this is a business.
Right.
It's not just, something that, is a money grab. They're not looking just at patient care. They're looking at the holistic, aspect of the business.
No, that's good. All right. If there's one feature that you can say about the Abyde, and you can't cheat, you can't say all of them, that you're like, I don't know how practices survive without this. Can you put your finger on one piece?
That's it. Yeah. No, I definitely can. So policy dynamic generation, right?
Okay.
So policy generation.
Yeah.
So I was kind of explaining it before, right? There's no drafting and editing of documentation in Abyde.
Okay.
And so if you're not using Abyde, there's no other solution out there that does that, right? We have competitors that provide templates. And, those templates have to be massaged and they have to be edited and they have to be updated. I mean, compliance is not a one and done.
Yeah.
It's something that has to be addressed on an ongoing basis. And so if you're going back and forth, between your security risk analysis or facility risk assessment and trying to match your policies that are affected based on the changes to each of those assessments, I mean, you really do need a compliance team, right? And so what a great way to avoid the headaches and the time constraints around doing that. If you just use Abyde, you fill in the information, you give it some answers, and it keeps all the documentation up to date. So to answer your question, I don't know how an organization could balance, patient care and profitability with their compliance programs if they're not using Abyde in that manner.
Yeah, that's good. That's really good. Going to let you play Merlin. So you get a magic wand, and you get to wave it, and you get to fix one thing about how dental practices should approach compliance. And you can't say, make HIPAA simpler. Like, what would that be?
Well, I think, we actually kind of see that happening, right? Where most practices want to make it so simple, they're only doing one aspect of compliance, right? We'd love to have them take the comprehensive approach, right? Where they're meeting all aspects of compliance, right? If I always make the joke, if I were to, go up and down, we can go right here in downtown Salt Lake City, right? Go ask 10 different practices, what does it mean to you to be compliant for HIPAA and OSHA? I always joke, you're gonna get about 15 to 20 different answers, right?
More than your, right.
And a lot of them are gonna say, oh, well, we're compliant because, and it's usually one statement, right?
Yeah.
We're compliant because we provide training to our employees. We're compliant because we get our patients to sign authorization forms, right? We're compliant because we work with a hazardous waste disposal company. But ultimately, there's so much more that goes into compliance than just one aspect.
Right.
And so hopefully, over time, practices can understand that it needs to be a comprehensive compliance program that's documented appropriately that will give them the peace of mind to be compliant.
Right.
So unfortunately, we hear all too often it's, just one thing or the other, when it really is it takes a lot of pieces coming together to build that picture of compliance.
Okay. Get to be Merlin now. So, prediction time. What do you see as the biggest thing that's coming around the corner? Everybody talks about AI and telehealth, or what do you see as the compliance kind of monsters that we potentially could face?
Yeah, and I think the problem with that is that we haven't done a good job right now of being compliant without AI.
Yeah. That's
right.
Good. That's a good point.
And so if it's advancing, we were just talking about it with some of the other vendors, that are in our space, here at the show. And, it's an ever evolving, process AI is, right? And so as soon as you feel like you have it, something else kind of bubbles up on the side. And it's like, have you thought about this?
Right.
And so for a practice who, again, their priority is probably not compliance, to, get up to speed with where we are today, and then also evolve as the technology evolves and AI evolves. Yeah. It's going to be something that, unfortunately will probably be too far in front of them to catch up. Yeah. And so, I can see that being a huge issue for organizations as we go into the future.
Yeah. Want to get tactical real quick for a second. Practice owner comes to you and says, I need help with compliance, right? I've got some stuff going on, but I also need my HR house in order. How do you typically approach that conversation? Because we look at it like, if you don't have proper workforce management, you're kind of shooting yourself already in the foot. So how do you kind of walk into those conversations?
This is why I love our companies, partnering together, because we are very complementary. And unfortunately, you can't have one side. You can't have Abyde without HR for Health. You can't have HR for Health without Abyde. Why? Because compliance is important, and it's ultimately something that's gonna flow through the whole organization, whether that's patient safety, worker safety, patient data privacy, and obviously making sure that your employees are taken care of and they have access to the things they need to have access to being an employee in the organization. And so it's very complementary. One of the things that, on our side, it doesn't matter who you get going with first, but you got to get going. And so, we definitely love bringing an HR for Health into the fold and into the conversation, to our prospective customers, to our current customers, because it is one of those things you can't do one without the other.
Yeah. This has been great. As we're wrapping this,
coffee's
almost gone too, right?
I'm losing my energy.
So
my
this
juice.
is the final question. It's important. So somebody listening, they're on the fence about investing in proper compliance solutions. They're like, is it time? What's the one thing you'd want them to walk away with understanding about the real cost of getting this wrong versus right?
There's such a cost, right? I mean, unfortunately, I keep talking about what we hear. We hear, all too often, I'm going to do the minimum at this point and I'll worry about it later. And it's like insurance. I always make the examples like a seatbelt, right?
Yep.
If you don't have it and you need it, it's too late.
Too late, yeah,
right?
That's good.
And so there's such a cost associated with that, right? And then there's a cost associated with trying to do it correctly.
Right.
And that's, we love our position. I know you all love your position in that as well, right? There's probably no easier, more cost-effective way for organizations to implement compliance programs than Abyde and HR for Health. And you have to look at the total cost of ownership, right? If you're just going to skim by with templated policies and procedures, and you're going to spend the time, updating them and trying to stay in touch with the state law, federal law changes, it's constantly changing. The minimal cost that you're spending on getting that template is just going to cost you so much more when you're figuring out how to do it correctly and spending the time to do it correctly. So one of those things, if you're going to do it right the first time. And that's where we feel like, our organizations do a great job of making sure that, total cost of ownership and the investment that these companies are making is worthwhile, right? Don't try to cut corners. We love to say station to station. Yeah. I'm a baseball guy. It's go to first, go to second, go to third, go to home. You can't get a single and score, right? And you can't cut across the diamond. And so, unfortunately, I feel like many organizations out there get to first base and they put their stake in the ground and say, we just got to run. Yeah. And I was like, no, you got a lot more to get to, right? And what is it going to cost for you to get around the bases at that point? Right. So I think looking at it from a holistic perspective of just like, what is my cost of ownership in trying to skate by under the radar, or do I ensure that I have what I need when I need it? Right.
No, I love the way that you buttoned up with that analogy. Just considering to time, date, and stamp this, the World Series is getting started today.
Today, right?
So yeah. So that's a great way to wrap this up and close. We really appreciate you. We appreciate everything you guys are doing at Abyde and the partnership and
same here.
All the things. Looking forward to all things to come.
Great. Thanks for having me.
Thank you.
Appreciate it.
Appreciate it.
Yeah.